Hello, everyone, and welcome to the second episode of the Open Mind Project. In case you missed the first episode, let me recap what the Open Mind Project actually is. The Open Mind Project is a podcast where every month I speak to a mental health professional about topics relating to their profession and teen mental health. The goal of the Open Mind Project is to help explain teen mental health and show what psychologists actually do in their everyday lives. Psychology can sometimes feel confusing or intimidating, so these conversations are meant to make it easier to understand and more relatable. By sharing both professional knowledge and personal experiences from people in this field, I want the teens listening to feel more informed, less alone, and more comfortable talking about mental health. Today, I'm excited to be joined by Dr. Divya Krishnamurthy. Dr. K is a board certified child, adolescent, and adult psychiatrist with over 15 years of experience supporting young people and families through challenges like anxiety, depression, trauma, ADHD, and mood disorders. She works across both private practices and community health settings, which give her many perspectives on what mental health care actually looks like in the real world and where it falls short. In addition to her clinical work, Dr. Krishnamurthy also serves as a mental health advisor to tech and AI companies, helping AI companies find ethical guidelines in their work. Her work sits at the interesting intersection of mental health and technology, and today we'll be talking about her experiences. I hope you liked the episode. Okay, yeah. And do you want to introduce yourself for the camera?
Yeah, so I'm a child and adolescent psychiatrist. I practice in San Diego and actually across all of California. So I do a mix of community clinics, several counties in California. Currently, I work in Los Angeles County, Riverside County, and in San Diego. And then I have a private practice where I see, patients who just contract with me individually or families and see them in private practice. And it's all virtual. It's been virtual for over 10 years now, well before COVID. And so the bulk of whom I see are teenagers, college kids, and then kids in elementary and middle school as well. So usually between 5 and 25.
Oh, okay. So wide age range.
Yeah.
Okay. Okay, so I guess we can get started then. So what what inspired you to like start working with like child and adolescents in psychology and helping them?
So I think right from when I was a kid, I was always drawn to that because my mom was a teacher and she was also studying psychology, so it was an interesting subject. I was exposed to other students, and I was a student myself, and so I always compared myself with like her students and how I'm doing versus how they do. Also, she had taken me to a special needs school, and I think that left an impact when I was younger, just to see how some kids just don't have the ability and how much more help they might need. And there's really not that many resources out there for them.
Mhm.
So I think with all that, I did want to pursue something with psychology, mental health, and kids.
Okay, okay. So you said you work with like smaller children and also teenagers, right?
Right.
Yeah, so how do their like struggles differ from like a smaller age to more like teen, adult, adolescent age?
So I think the really smaller ones, who are closer to 5, whom I see, a lot of them have developmental issues. They might have had birth trauma. They might have been exposed to, substances that their mom might have used. Some of them ended up in foster care. They've had early childhood trauma. And then I get to see them with mostly behavior issues and learning issues. And a lot of those are linked to those early childhood problems that they had.
Yeah.
Versus teenagers, I think a lot of it is their relationship to family, friends, peer influences, substance use. And I think the bulk of it is school pressure, really, just having to deal with all the expectations placed on them.
So could you go more into that like school pressure, like kind of explain it a little more, what they feel? I mean,
So
without breaking confidentiality, of course.
yeah, of course. So I think across the board, I think it's very obvious that teenagers are stressed with schoolwork
Yeah.
because there is a lot of schoolwork. I think over the years, most generations would agree that this was not the level of expectations they had as far as academic work goes, as far as other expectations of things they have to do, worries about the future, going to college or getting a job right away. There's just a lot more pressures today. They've always been there, but it feels like with every generation, there's more and more expectations. And then you have a certain number of kids who meet these expectations, and then the bar, I think, keeps getting raised for all the other kids.
Yeah. Okay. Okay. So when you're working with kids, do you also like talk with their parents or their other like family?
Absolutely. Yeah, I think that's really the key of the treatment is mostly with the parents, I would say. Most parents come in saying, there's a problem with the kid, but as treatment goes on, we know that kids don't exist in a vacuum and, it's usually a family problem or communication problem or sometimes just the problem of the parents. So I think that's challenging because, it's hard for a parent to acknowledge that they might be what's, causing the problem for the child, but so that's kind of tricky. But a lot of times I think once they see that, it becomes easier, for them to learn ways to deal with it and work with the child.
Okay. So, like, what are some strategies that parents could use to help their children?
So I think first of all is just acknowledging that, I mean, they're concerned. I mean, part of why a parent might bring their child for treatment, if at all, is because they're worried about the kid.
Uh,
Or part of why parents push their children to do more or, worried about their school performances because they want them to be successful. And some of that is rooted with the parents' own fears that somehow they won't be successful. And that might be a reflection of, things that might have happened in the parent's life or anxieties they might have, which have nothing to do with the kid at all. So I think just separating that and also giving them that confidence that kids, a lot of teenagers, they are very smart, they are hardworking, they want to be successful themselves. They have goals, they have motivations, but the way they might be going about it is different than the way the parent might want them to go about it.
okay.
So creating that trust that, they can step back and let the teenager sort of figure this out and
Mhm.
it's going to be okay. I think that's sort of where the process goes usually.
Okay. Okay. So you worked in community health as well as like public practice, or sorry, private practices.
Right.
So what's like the different environments like that? Like how are they?
So I think the biggest difference is socioeconomic, that, community practice are usually lower income families. So there's a lot of financial stress versus the private practice are usually cash paying patients. So it's not the finances that are an issue. So there's other intrinsic factors, there's family dynamics. So there's a lot of commonalities in just what kids feel and what families feel and how they relate with each other. But I think the big difference is that one group, also has the financial stress and lack of opportunities that maybe the other group has.
Okay. Okay. So okay, that's good. What what are like because I know there's a lot of like cultural expectations or even like some generational differences like some parents may not understand. So what are like the cultural aspects? How do they influence a teen's mental health?
I think they play a pretty big role. And, especially you see that in California with the diversity of groups that are there, lots of immigrant families. I think one of the biggest challenges is getting the parent to see it from the kid's lens because often they see it from, where they're from. So culturally, based on where they're from and how things worked back then, is how they operate. You'd often hear a parent saying, well, in our time, we did it this way, or, we would never do it this way, but, you're not them.
Mhm.
And that's a little hard, I think, for parents to recognize that this is a different time, it's a different country, different culture, and maybe the same rules don't apply.
Okay. Okay. So I know like sometimes like do like your clients do they if they don't like accept the process or like they don't trust the process or they don't respond to treatments, like what do you do in that scenario?
So I think what I try to do is really get their buy-in, why they're here in the first place, or even if they got dragged by a parent, if they had to be dragged by a parent, what do they want to get out of this time together? Um, Usually every kid has some motivation, to be successful or to get something. It might be an external thing, I want this more time to play the video game. Usually you see that with younger kids. With the older kids, they want more freedom. And that's usually a good buy-in that, if you want more freedom, then you got to demonstrate more responsibility, accountability, have a good mood, and if you really want to be able to do things in life. And I think the other big motivation as kids get older is they want a job because they want money, they want freedom. So again, if you had to hold a job, you would need to have stability in your mental health.
Okay. Okay. So you were talking about this before, but are there any other like early kind of red flags that show like later in life there might be some problems with teens' health? Like you were saying, if there was like substance abuse during the pregnancy, but is there any other factors that could also result in like later mental
Yeah,
health?
I think there's lots of factors. In the younger kids, you could see mood
Mhm.
regulation issues when you have a kid who throws tantrums excessively, or they have, persistent anxiety about going to places or doing things that kids would like to do. You could tell from signs of depression where a kid might, be excited about some things for a bit and then lose that motivation. As they get older, I think substance use is definitely a barrier to to good mental health. So I think kids who get into that earlier on are at more risk for, more mental health issues and other problems. You can tell from disruptive behavior, school performance. So there's lots of different ways of telling, and I think it's checking that every time, you notice it.
Mhm. Okay, okay. Is there anything you wish you could like schools would like understand about mental health? Do you think like schools they have I know academic pressure is like one of the main motivators, but do you think schools can like do anything to help mental health out? Or
I think schools have been getting better in addressing this issue for sure, but they're just overwhelmed. I think, they have resources, but they just don't have enough resources. I think it would help to have, different pathways for different kids, have more options in, what they study, how they study. It would definitely help if they had more support staff, more counselors in school. So a lot of these get tied to resources, but I think also understanding, the workload might feel differently for different students, and being sensitive to that, and really being able to channel sort of some students are not that great at academic work, having some alternatives like more skill-based learning or other ways of learning that might help them.
okay, okay. So okay, just pivoting away from that a little bit, I saw that you offered like insight with like AI and tech companies. Could you just explain what that is a little bit?
So I think, that's evolved over
Yeah.
the last decade. Now with generative AI, I think one of the worries is that AI doesn't hold the same standards as, say, most professionals would. So if I had to see someone, one of my biggest concerns would be safety. And so I want to make sure they were safe to themselves, to others. I'd check for substance use, and I'd be able to pick up just based on conversation that, these are some areas to explore further. And I think that sort of guardrail is still evolving with AI, and how to pick that up and how to intervene. So I think while it can certainly be useful when a kid or even an adult is talking endlessly to an AI and it doesn't necessarily have these guardrails, that can potentially become pretty dangerous.
Okay. Okay, okay. So, okay. Wait, what insight do you offer, like specifically to the
So I would let them know if they had, if first of all it was ethical. So let's say
Mhm.
there was an AI product, I would sort of evaluate that from the lens of, does this seem ethical and useful, first of all? Is this their applicability for this in the general population? And how would that either assist another human being like a clinician, or what is the direct benefit it would have for this patient and how? And I think that how part is where um, I provide that insight into, the difference between what a clinician might do versus how an AI might approach this. But I think the biggest challenge is putting those guardrails on safety. So picking up on any hints of suicide, dangerousness to anyone, or substance use. And I think that these three areas have been a little bit lacking from some of the people I've spoken to, because it's sort of ambiguous.
Mhm.
And even if you did pick that up, what would the AI practically do? Because, there's no one to like pick up the phone and call someone and get them involved.
Yeah. Yeah. Do
So
you
I think that's kind of why we're a little bit stuck with the AI, and it's not, rolled out for mental health as much as maybe it could have been.
Mm, yeah. But do you feel like I feel like it could still be good for mental health because a lot of kids, they might like be a little scared to reach out. And I feel like AI, you can just have it in your pocket and it's just someone to talk to. Do you like agree?
Absolutely. Yeah, no, I absolutely agree with that part. But I think the part is when there's a couple of dangers with that. So the difference between going and talking to a professional is that, there's somebody else involved. Whereas here it's sort of there's nobody else involved, and you could have an endless conversation, which might be helpful in some ways, but depending on how that conversation goes, there's no intervention. So if, let's say you were struggling and a parent needed to know that who could directly support and help you because you live with them, there's no way of them knowing you were struggling in that way unless you actually tell them.
Hmm.
Versus you could be talking about that to AI and, getting feedback and help, but if it's not something that if you're still struggling, taking it to that next step of saying the AI is not gonna, ChatGPT is not gonna tell your parents that, maybe you need some help.
Yeah. Okay. Okay. So you've spent a lot of time in this field, like over 15 years. So what like changes or trends have you seen in mental health over this span of time?
So I think on the positive, definitely more awareness, more, diagnostic methods, more support from schools, and I think the community in general. There's a lot more push for people to get help, and I think a lot more people are getting help.
Hmm.
But on the negative, there's definitely an increase, and because of that, to some extent, we're seeing an increase in anxiety and depression, and there's this feeling that all that is a lot more. It may be because we're diagnosing it more,
Hmm.
or it is a lot more, but it definitely feels like it's a lot more than it has been in the past decade.
Okay. Okay. So, how important would you say like sleep and like stress managing techniques are in kind of regulating yourself and your own mental health?
I think it's vital. So that's one of my, classic lines is for with all my patients is you got to be sleeping well, you got to have good nutrition, and you got to get your exercise in because these are the three pillars of good mental health. And regardless of whether you do therapy, medication, whatever else is out there, you still got to do these three things for your long-term mental health. So I
Okay.
think it's vital. I think, and this is also a sign if one of these three is off, then that's also a sign that, maybe something is off with your overall health.
Okay. Okay. Okay, we can start wrapping up just a few more questions. Um so what would you say to like a parent that's watching this that and like they may not know about their child's mental health struggles? What would you say to them?
And let's say talk to your kid and, talk to your kid about anything and everything and, as many times as you can or as little, but, whether it's a car ride, whether it's watching a show together, whether it's dinner, definitely try to do a meal together. But, catch them at a lot of different times and, don't just talk to them about college admissions, how's high school going, or, only talk to them when something seems off and say, why are you always in your room and not coming out? So catch them at several moments and keep that channel of communication going and observe for any patterns of, things that might be off because they should be knowing their kid. They've seen their kid all their life, and so they should be able to pick up on if something is off.
Okay. Okay. So,
Get help if
yeah,
if you see, yeah, if you see something's off, don't wait. Go um, seek help from a professional.
okay. And what would you tell like a young person or a kid even going through their own struggles right now? What would you tell them?
I'd say lean on your supports. It might start off with a friend, it might be, an AI thing, but think about the supports that are closest to you in your life and at home, and that would probably be your family. And even if it might feel like you can't talk to them, find a way to do that because at the end of the day, that's whom you live with. That's your front line
Yeah, okay.
and also other adults in your life, teachers, counselors, coaches, and but use the supports you have.
Mhm.
You're not alone. I think that's what I would want them to know. You're not alone, even though it might feel that way at times.